Hi, everybody, and welcome to our talk today on disaster, humanitarian response, and EMS. My name is Sean Kivlehan. I'm the Global Emergency Medicine Fellowship Director at Brigham and Women's Hospital in Boston and faculty at Harvard Humanitarian Initiative. So, topic that we're going to cover, or a few big topics, but I'm going to try to make it as concise and straightforward as possible to provide you with a high-level overview so you know where you can get further information. We have three main objectives. The first is to discuss humanitarian response effort strategies and organizations and try to make you familiar with who are the different players in this sector. Then we'll talk about EMS in the international setting. And finally, a brief talk about how you can get involved and what are career opportunities in general and specifically for ER doctors. First, let's go through some definitions. So what is humanitarianism? There's a lot of different definitions out there, but I went to the source, which is through the United Nations, the Global Humanitarian Overview, which we'll talk about in a few more minutes, and also the International Committee of the Red Cross, and some other humanitarian organizations to get a joint definition. And really, it's more than just a definition. It's an ideology. This is taken from the Sphere Handbook, which are general guidelines for humanitarian response that all of those organizations I just mentioned had input in. So the ideology of humanitarianism is that all people affected by disaster or conflict have a right to receive protection and assistance to ensure the basic conditions for life with dignity. The humanitarian principles are reflected in international law, but they ultimately derive their force from the fundamental moral principle of humanity, which is that all human beings are born free and equal in dignity and rights. We'll revisit the humanitarian principles a little later. And the last part of this is the humanitarian imperative. And this is that action should be taken to prevent or alleviate human suffering arising out of disaster or conflict, and that nothing should override this principle. We'll talk more about the imperative later on as well. Some core definitions of a humanitarian emergency. And you may think, what is a humanitarian emergency or humanitarian crisis, and what makes it different from a disaster? Well, generally, the scope and the scale of it are both much larger in a humanitarian emergency than in what we would refer to as a disaster, although, of course, both could be called disasters. So, in general, a humanitarian emergency is considered something that is a critical threat to the health, safety, security, or well-being of a community or other large group of people, usually over a wide area. These can be natural disasters like floods and earthquakes. They can be human-made disasters like wars or industrial accidents, or they can be complex emergencies. A complex emergency or a complex humanitarian emergency occurs when there is a total or considerable breakdown of authority resulting from internal or external conflict, which requires an international response. And these types of situations of this scale is what we're going to be focusing on today for the humanitarian portion of this talk. Let's start with a little bit about the scope of the problem. This is from the Global Humanitarian Needs Overview. The 2023 version was just published and is accessible online. And this is a map of the areas of the world where there are active humanitarian response plans and the percentage of people that are being targeted with humanitarian action in those areas. You can see overall 339 million people are in need or anticipated to be in need in the coming year. And the plans do not target everybody. They're inadequate even at this level of goal. The situation continues to worsen over the years. And one of the biggest drivers of humanitarian crises is displaced persons. So as people are displaced, whether they are internally displaced within their own country or externally displaced to another country as a refugee, the resulting upheaval has very widespread effects on their well-being and the well-being of those around them. As you can see from this chart, the number of people forced to flee worldwide continues to increase. Some key crises are noted here. The start of the Syrian crisis in 2011, the war in Yemen beginning in 2015, followed by the crisis in Venezuela beginning in 2017, and then the Tigray crisis in Ethiopia, followed by currently the war in Ukraine, which continues to generate more and more displaced persons who are in need of humanitarian assistance. One of the biggest aspects of humanitarian need and assistance has to do with food. And although it affects many other sectors, I specifically pulled out food because of the scope of the issue here. And just to show you from the current numbers, people that are suffering from acute food insecurity in humanitarian response plan countries. And you can see this, the hundreds of millions of people, and really some of the leading countries on the left here, the DRC, Afghanistan, Ethiopia. And you can learn more about this at the World Food Program and through their IPC and other scaling programs of how they evaluate and manage food crises. Climate change, which is becoming increasingly recognized finally, is a major driver of the worsening of humanitarian crises. This graph pulls out disasters that were thought to be climate related. These have to do with floods, storms, droughts, extremes of temperatures, fires, and you can see they've almost tripled in the 2020s compared to the 1980s, and this graph continues to rise, and we're only going to see more of this as climate change continues. Related to health, while there are many issues to talk about, I pulled one highlight here having to do with COVID. And you can imagine the effect that COVID has had on humanitarian response worldwide. It's been very significant. And this is just one piece of that effect, was our poor response as a global community to the people most in need in humanitarian crises. This graph looks at COVID vaccine rates in the world, how many people, and you can see on the axis, on the y-axis on the left, it is in billions, how many people in the world have been vaccinated, and then you can see at the very bottom, it almost looks like a flat line, the yellow line showing how many people within the countries that are currently under a humanitarian response plan were vaccinated, and you can see almost none. And it's a real problem, and it's reflective not just of COVID, but of overall health care. The last thing I'll talk about as a high-level concept is the ability to safely deliver humanitarian aid around the world. And there are many measures of this, but this is one measure to look at, which is aid worker security incidents. And you can see they continue to be high and continue to rise around the world. This could be used to look at security in general as well. Many of the places in the world suffering the largest humanitarian crises right now are very inaccessible to humanitarian support. And this has to do for a variety of reasons and shows the importance of negotiation and working with partners to gain access to areas. Another thing I want to talk about in this chart, though, if you look closer at the bar graph, the darker yellow are national victims and the lighter yellow are international victims. So I think when many people think of humanitarian aid, particularly from a Western lens or from the United States, we think of it as international people going somewhere to help. But as you can see from this, the majority of aid is actually given locally, and also the majority of people suffering security incidents is occurring with local staff and national victims. International participants actually play a relatively smaller role here. And I want to dive a little further into that to talk a little bit about the colonial history of humanitarian aid, which is being increasingly recognized and is really critical that we talk about. At this point, I would say no talk about humanitarian response or global health in general is complete without an acknowledgement of the colonial history and its intertwining with humanitarian response and global health. On the left here, you can see a drawing that was pulled from an article in PLOS Med. The citation's at the bottom if you want to take a look at it. It's a very good article that highlights a lot of the disturbing history of humanitarianism and global health. But here in this cartoon, it shows some of the key issues. The elephant in the room is the power and the privilege of the people of the West who come to provide the aid or fund the aid. And then you can see all of the problems that surround it that we don't talk about and are essentially blindfolded to, just like in the cartoon. On the right is a screenshot of the cover of a report that was led by Peace Direct, but also several other organizations you can see at the bottom, called Time to Decolonize Aid. This came out in 2021, and it's freely accessible online, and I highly recommend that anybody engaging this work download it and take the time to read it. This is images from a paper that was recently published in BMJ Global Health earlier this year, and led by Stephanie Garburn and her team. What they did is they took papers published in the Global Emergency Medicine Literature Review, or reviewed by the Global Emergency Medicine Literature Review, over 5 years. They looked at all the papers that had research done in low and middle income countries as defined by the World Bank criteria. You can see on pane A in the left here, these are all the countries where the research was performed. And darker green means more research was performed there. So this is the country where the paper was done. But then on the right, the top right in pane B, is the country of the first author of the paper. And you can see that there's a very drastic change where, although the work was done in low and middle income countries, most of the first authors came from high income countries such as the US or also throughout Europe. Pane C in the bottom right is the senior authors, and you can see that pattern is reflected, that what we consider positions of power on academic publications, first or last author, are dominated by high income country authors, although the work is done in low and middle income countries. And this is just one of many examples of the inequity in humanitarianism and particularly academic global health that we need to change. So now let's shift gears and talk about the players. So if you're going to work in the humanitarian sector, you need to know who are all of the people interacting and how do you interact with them. At the end, I'll highlight some ways to get involved, but it's important to note that all of these players, this is how you get involved. The next few slides, I'm going to talk about a number of different organizations, and if you're interested in doing humanitarian work, go to their website and sign up and apply. Particularly as an ER doctor, you're more than qualified to join any of these emergency rosters, and you'd be a very competitive applicant. So my advice is poke around on the internet, look for their emergency rosters, look at how to apply, learn more about them. We're going to start with ICRC, or the International Committee of the Red Cross. So ICRC is really closely associated with the concept of humanitarianism, and from the Western lens that we talk about of humanitarianism, it's really almost considered the beginning of modern humanitarianism. And this occurred by when Henry Durant was traveling. He's a Swiss businessman who was traveling and witnessed the aftermath of the Battle of Solferino in 1859. And it really horrified him seeing the death and the destruction, and in particular the lack of any care for the wounded on the battlefield after the battle was over, that people were just left to die and they had very inadequate health care or first aid or anything. This inspired him to go back and, through a lot of work, found the ICRC in 1859. So the ICRC still today is an independent and neutral organization that ensures humanitarian protection and assistance of victims of armed conflict. It's an incredible organization, and they're connected to many other things, such as the Federation and the movement of the Red Cross and the Red Crescent. And I encourage you to go to their website and learn more about it. One important thing is they're often considered the guardians of the Geneva Conventions, because Henry Durant, in addition to founding ICRC, he created or led the movement towards the first Geneva Convention, which was agreed upon in 1864. And this first Geneva Convention defined that people who are injured in the battlefield should have access to care, and that care should be unfettered. And the people providing care, the non-combatants who are helping the injured in a battlefield, should not be targeted with violence. And these are still foundational wartime rules that we try to abide by today as a human society, albeit with some major challenges. The Geneva Convention, after the first one, was followed by several others, and I encourage you to go and read more about the process. Now onto the NGOs. So it's important to note that ICRC is not considered an NGO or a non-governmental organization. The ICRC is a neutral, independent body. It's kind of a unique entity. Whereas NGOs as a whole, these are all of these often familiar names that you recognize here on the right. This is just a sampling of some bigger name NGOs that most of you are probably already familiar with, although there are many, many more on the order of thousands to tens of thousands. These NGOs can be local or international. All of the ones here that you see are international. They can be religious oriented or they can be secular. They really vary widely in what their goals are: specific program oriented, broad-based, advocacy oriented, relief or development. So take a look, and again, this is a way to get involved. Look through their websites, understand their mission statements, and several of these organizations regularly hire emergency doctors to join their rosters and participate in their responses. NGOs, by definition, are meant to be independent from governments. However, there is another important player in humanitarian, and that is the donors. And it's important to note that the money for this, humanitarian aid, is not cheap, and the money comes from somewhere. These are all government donors that you can see here on the right that are very well known, but there are also private donors as well and large philanthropic organizations. Every donor, whether government or non-government donor, has different approaches and different priorities. A lot of government-based aid is often criticized as soft force to encourage change or influence other governments or other parts of the world, and that is true. So it is important that you look critically at where the aid is coming from when you're deciding a response and what to participate in. The donors, they have broad, complex relationships often with national governments, both their home government and other governments. And their accountability is to the donor government and also to the taxpayers that are ultimately supporting it. The next major player are the governments themselves. These could be the governments where the crisis is occurring, surrounding countries, or donor governments. And the geopolitics that are at play, they influence aid and humanitarian aid. And it's important to educate yourself and become aware of this. And it's also important to not just focus on the national level governments, but also regional and local level governments, which are critical in a humanitarian response. The primary responsibility for any government is the well-being of its population, and they should be focused on providing the best humanitarian response for their people. There can often be tension between the assertion of leadership of the local government and balancing that with the recognition of need for assistance. Most important actor in the humanitarian space is the local population, and sometimes this is the directly affected population and other times the indirectly affected population, but in all times there is a local population. These are very diverse depending on where it occurs and what time it occurs. They are always the first responders. Humanitarians often like to think of ourselves as the first responders, but the true first responders are the people who were there when whatever it is happened, and empowering and training them to be able to provide an adequate response is critical. Over the past few years, there's been a new and very important and overdue focus on accountability to affected populations and to localization of aid, which we'll talk more about in a few minutes. The military is also a key player in humanitarian response, and their role can vary fairly significantly depending on the situation. So you can see on the left of the diagram, during a peacetime deployment, there can be cooperation, where there can be co-location of the military and the humanitarian organization. And that goes all the way to the right side in the red, which is a situation where there is active combat. And here it's coexistence. And you have humanitarian organizations may be present, but they are not directly interacting with the military. They're keeping separate to maintain their neutrality. They coexist in the same space by default, and what they'll do is they'll create an interlocutor who can drive the communication between them. And that mechanism is led by the UN SIMCORD agency, which is the United Nations Civil Military Coordination Group. They have a web page that outlines their principles, and you can download their field handbook. The most recent version came out in 2018, and it's available for free online. And it outlines the key roles that the military plays in any humanitarian response and how that role will change based on the context. Finally, there's the United Nations. The United Nations is a large organization, and you can see some of the key groups that you may interact with in a humanitarian response here on the right. The UN was founded in 1945 in the aftermath of World War II, really in an effort to prevent anything like that from ever happening again. Initially, there was 51 members, which now is up to 193. It's an extremely large and sprawling organization with many agencies and funds and programs. Again, the key ones that you may interact with are here on the right of the screen. And again, like the NGOs, if you're looking to get involved in this type of work, this is another great place to start. Go to their websites and look up how to apply, how to get internships, how to engage with them. And that's how a lot of people get their start, is through an internship with one of these organizations. The UN by default is more closely aligned with the government than NGOs often are. And the UN initially did not have as direct of a role in humanitarian response, but this changed in 1991 when the General Assembly resolution formed the Department of Humanitarian Affairs, which put a direct mandate under the UN for managing and coordinating humanitarian efforts. The Department of Humanitarian Affairs turned into OCHA in 1998. And OCHA is what we'll now talk about because they are a key player in any humanitarian response. OCHA is the UN Office for the Coordination of Humanitarian Affairs. They do many things, and you can see some highlights at the bottom of the screen here. Coordinating financing through the SURF and through pooled funds to help provide emergency financing, setting policy and best practices of humanitarian response, advocating around the world for funds and for access, and also information management. They manage a number of key websites in the humanitarian space that you can see on the right here. So the SURF, Relief Web, which is another great website if you're looking to get involved in humanitarian work, go to reliefweb.int, and they have a large classified section where essentially every organization in the humanitarian world is posting their opportunities. They also have the financial tracking service and the ISC, GDAX, a number of key websites that are great to get information on any humanitarian crisis. I encourage you to check them all out. You've probably heard of the cluster system or are familiar with it. And the cluster system is something that came about to help coordinate the way aid is delivered. As you can imagine, humanitarian aid is incredibly complex. There's so many different players involved from so many different parts of the world, all with different priorities and different skill sets. What OCHA has tried to do is to manage this within the cluster system, and you can see this here on the slide. There are a number of different clusters, and if you go around, starting at the bottom, you can see camp coordination and management, early recovery, education, emergency telecoms, and it goes all the way around. For each cluster, there is an identified lead agency, and that is written underneath the cluster name here. So you can see for emergency telecommunications, it's the World Food Program. For food security, it's a dual leadership role, WFP and FAO. For health, it's the World Health Organization, and so on. It's critical that if you're going to engage in any humanitarian response, that you familiarize yourself with this setup. The cluster system fits into the larger architecture, which I will admit gets quite confusing and quite bureaucratic. This is from OCHA and the IASC, which is the Interagency Standing Committee, and these are effectively the governing bodies of humanitarian response in the world. And this is their agreed upon architecture of the cluster approach. You can see on the left is where UN OCHA sits, and then they have an HC, who's the humanitarian coordinator and a humanitarian country team, and that team interacts with everybody else. The ERC, who's the emergency relief coordinator, who's the liaison to the IASC, and then down to the chief of mission, and then each cluster coordinator. And you can also see how the government is involved and the global cluster leads. Each cluster has a global standing cluster, and you can look at the website for each cluster. Just Google it and it will come up, and there's a lot of great information. And then for each individual crisis, there will be an identified cluster lead that communicates with that global cluster. So zooming out and trying to look at the whole system, trying to understand how does this all get put together? Well, there's the traditional view of the humanitarian system, which I'll walk you through right now. You have at the center the UN and all of its agencies that we just spoke about. And then you have the international NGOs and local NGOs and organizations. You have the donor states, which I just talked about, and then the host states who are funded by the donor states, and their different ministries of health and so on and so forth. You have the affected communities who are suffering from the disaster or whatever the crisis may be. You have the ICRC, and then you have the public and foundations and corporations and charities and everybody who's donating and contributing in some form. At the center of this, though, of this whole diagram, is the UN, the NGOs, and the ICRC, which not accidentally were the ones that I first talked about in this talk. Now, this traditional view, much like many other things in humanitarianism and global health, is finally being challenged. And this is the more modern, the ecosystem view of a humanitarian system. And you can see in the top left is what I just walked you through. It's that same thing, but it's much smaller now. And now at the center are the affected communities, the people who are affected by the crisis, by the disaster, who need the humanitarian aid. And then all of the things that are feeding into the affected communities who are at the center of the humanitarian response. You have all of these non-OECD donors, Global South NGOs, faith organizations. So these are the people that are left out of those big NGO discussions and not really included in organizations like the IASC leadership. You have not just formal militaries, but political parties and informal militaries or armed groups who play, the reality is they play important roles locally depending on the context. And then the responders of first resort, which are the local population, everybody around who's helping before any foreigners get there, the local organizations and the business community and any local government. But the key here is that the center of the response is the affected community, and everything else is going into that. And also key here is that in this ecosystem view, what we consider the humanitarian sector, that traditional view, is only just a small piece of the bigger puzzle in the top left of the screen here now. I want to take a minute to zoom out even further. And there's a concept called the Humanitarian Development Peace Nexus, which is recognizing that humanitarian aid alone is not enough, and it needs to be delivered in conjunction with development and the maintenance of peace. So now you can see at the center here is the diagram that we just went through on a prior slide. But added in on the right are the development sector aspects of building long-term structures that are meaningful and strengthening capacity. Also at the bottom, the peace sector efforts and all the UN missions and regional and international bodies that help lead to this. Because without these inputs of peace and development, the humanitarian response is incomplete. There are some guidelines to help you along the way. I mentioned earlier the SPHERE project. So I encourage you to go online and Google the SPHERE handbook or the SPHERE project It's just celebrating its 25th anniversary now. The most current edition of the handbook is this one, the purple one, and it was published in 2018. It's available free online. You can download the PDF. If you're going to participate in humanitarian response of any sort, I would consider this required reading. It provides general guidance, a review of the foundational principles of humanitarian response, the history of humanitarianism, international humanitarian law, protection principles, codes of conduct. But then critically, it goes through 4 technical sectors: shelter, food, health, and WASH, or water, sanitation, and hygiene. And in each of these technical sectors, it provides standards and indicators of what are the minimum standards of a humanitarian response, and how can you achieve those standards to maintain dignity for the people in need of humanitarian response. There's also a number of cross-cutting themes in humanitarian response that it goes through. Related to that, and developed by the same group, is the core humanitarian standards. And this goes through 9 standards that you can see listed here, and I won't go through each one, but they surround the center, which is the community and people affected by a crisis. Also surrounding that are the 4 humanitarian principles, which we'll talk about in the next slide. However, I encourage you to take a few minutes and read through these core humanitarian standards and try to truly understand them, as these are the standards that you should be holding yourself to if you're ever participating in humanitarian work. The humanitarian principles are listed here: humanity, neutrality, impartiality, and independence. These are critical in any humanitarian response, that they're upheld by all humanitarian workers. Some are straightforward, like humanity and addressing suffering wherever it is found. However, neutrality can get more complicated, particularly in conflict settings or in wars. And it is important that as a humanitarian, you may remain neutral despite your personal beliefs, and you do not engage in controversies. Impartiality is the principle that humanitarian action should be given on the basis of need alone and should not be discriminatory in any sense. And finally, independence, and that is that humanitarian aid should be independent of government or political or military objectives. These are sometimes hard standards to meet, but it is important that we follow them and use them as our goalpost of what is a proper and effective humanitarian response. So that's it for the humanitarian section. Now we will switch into a brief bit on EMS, or Emergency Medical Services. So to quickly touch on some global EMS, I decided to focus the conversation on the World Health Organization Emergency Care Program's efforts to frame an emergency care system. So, and you can see here an image that I particularly like, as it shows all of the things that emergency care manages, which, as we all know, is everything. It's NCDs, non-communicable diseases, the person with chest pain. It's trauma, car accidents, road traffic safety is all emergency care. Maternal and child health is emergency care. Pediatrics, infectious disease, just like we all know as ER doctors, it doesn't matter the age, if it's injury, if it's medical, it's all something that's treated in an emergency department. What the emergency care system framework really tries to look at here. Now, I'm not going to spend time going through this whole framework, although I encourage you to do so yourself and explore their website for more information on the efforts the WHO is making towards emergency care. But what I want to highlight here is how much of it is EMS. So the first column here, scene care, is all EMS. The second column here, transport, is also all EMS. And the third column, facility, ends in EMS. So when you look at an emergency care system, EMS is actually most of the system. And in so many cases, it's an afterthought after facility-based emergency care. Facility-based emergency care is critical, but so is EMS. And we're going to walk through some of these key EMS steps. So just like any humanitarian response, the first responder is always the bystander. It's always the person who's there. Somebody witnesses the event, or maybe it's the person themselves who had something happen to them. and they call for help and they try to render first aid, they need to be able to make a phone call to a dispatcher who can provide them with some pre-arrival instructions. But then that dispatcher needs to be able to activate resources. And those resources need to be able to send a trained provider to the patient with portable equipment who can go and provide care on the scene. There's a lot of things that need to be done to allow this to happen. Things like bystander protection laws or Good Samaritan laws. Publicly accessible emergency care access numbers like 911 in the US. Clear pre-arrival instructions by dispatchers that can be easily followed by the public. A centralized dispatch that can coordinate all of the different resources that are out there. Trained pre-hospital providers who can actually respond in a vehicle with equipment to the scene and provide care. Then there's the transport aspect. So the ambulance should be certified. There should be key components that are already in the ambulance. The provider should be with the patient at all times. They should be in the back, and then there should be a separate driver. And even if only simple things are done, such as positioning or interventions and monitoring, it's critical that a provider is with the patient. There needs to be clinical protocols that are standardized. There needs to be communication so that the ambulance can communicate not just with the dispatcher, but also with the facility. Documentation of any patient care and a minimum equipment set of equipment that is applicable and works. Finally, there should be a mechanism to notify the facilities that the ambulance is. On arrival to the facility, there needs to be handover from the ambulance provider to a hospital provider. This should be face-to-face handover. And the last place that EMS takes part in the emergency care system is at disposition from the facility. If the patient is transferred to another facility, or if they are discharged home or discharged to a rehab facility, they may require ambulance transfer. When you break down EMS, there are some differences in really added functions from facility-based care that need to be addressed. The concept of call taking. Somebody needs to receive the phone calls. Then they need to dispatch the resources. The resource, i.e. the ambulance, needs to be able to actually respond, provide patient care, transport while providing ongoing patient care, and then hand over the patient to the destination facility. Breaking out each of these, you can see the key things that we talked about. Access number, arrival instructions, centralization of dispatch, response and dissemination of ambulance stations, laws around light and siren use. Patient care, this requires training, educational standards, certification, and then transport both from a scene to a facility, but interfacility transfer, which is critically important as well. And finally, documentation and handover, both written and verbal. For all of these aspects, we need to create standards, protocols, training, quality assurance. EMS looks very different around the world. There's the two competing major models, the Western Anglo model, which is the US-based model of EMTs and paramedics providing brief field care and rapidly transporting the patient to a destination. And then there's the more European-centric Franco-German model, which is often physician or other healthcare driven, which involves treating the patient on scene more and then a delayed transfer to the facility. It's an ongoing debate which one of these is best, but it's important to understand what is the EMS system wherever you're working. The system may not be recognizable at first, so you need to learn and ask and understand. And then you can apply these standardized templates or frameworks to try to create an efficient system. There's more information about this available on the WHO website. So to wrap up, how can I get involved? Well, we talked throughout this in ways you can get involved by reaching out to all of those different organizations, the UN organizations, the WHO, the different NGOs, the ICRC. All of them have opportunities for involvement. ReliefWeb is a great website to go to and to look at classifieds. Then there's some other ones that I want to mention. MSF runs Epicentra, which is their research arm looking at epidemiology, specifically oftentimes of humanitarian response. Evidence Aid is a great open access tool that is always looking for help, reviewing research, looking at humanitarian response. URD is another one of many online resources that provides a lot of humanitarian education that you can get involved with. Taking the HELP course with the ICRC, this is offered around the world every year, and it is a great 2-week course teaching people how to provide an effective humanitarian response. Similarly, where I am at Harvard, we have the Humanitarian Academy at Harvard where we run a number of training classes, Humanitarian Response Intensive course, and several other humanitarian-oriented courses that you can look at on our website for more information. The Building a Better Response is a free online course that was jointly made by IMC, Concern, HHI, and USAID. And this is an excellent primer on how to participate in a humanitarian response. And I highly recommend that anybody considering this work take this course online for free. Additionally, a note on safety. It's important to ensure your own safety and the safety of those around you if you're going to do a humanitarian response. A free online and efficient primer on that is the UN Be Safe course, which you can Google UN Be Safe and take that course for free. It's an excellent preparation on security in the humanitarian setting. Specific to ER doctors, there are other ways to get involved also. Sometimes it's through one of these organizations. One way is to do a fellowship if you're looking at a career in academic global emergency medicine or humanitarianism. There are a number of global emergency medicine fellowships around the country, about 35, and they're coordinated by the SAM-GEMA, the Global Emergency Medicine Academy. When you're thinking about what to do, I recommend this article. This is a really great article, and in my opinion, probably the most efficient read on the topic that has been published recently, written by 2 of my mentors, Parveen Parmar, who's at USC, and Greg Greeno, who's still at Brigham. And it goes through the specifics of how to engage in a humanitarian response as an ER doctor. And you can download this online, and I'd highly recommend reading it if you're considering this. Not only does it share some best practices, but it also provides a list of opportunities of how you can get involved. Several organizations that you may already be involved with are out there. ACEP has an international emergency section that you can get involved with. SAM has GEMA, the Global Emergency Medicine Academy. IFEM, the International Federation for Emergency Medicine, has an incredible amount of resources online. GEMLR is the Global Emergency Medicine Literature Review, which is a large group of physicians who do a review of all the global EM literature every year. And AFEM is one of many regional organizations that provide a good foundational starting point to learn about emergency systems in different parts of the world and to meet collaborators and to try to understand how you can better get involved. But to summarize, one thing I do feel strongly about for humanitarianism and global emergency medicine work is that emergency physicians are the perfect fit for this job. And that's because we do a little bit of everything, do it anytime, anywhere, and have a broad skill set and knowledge base that allows us to understand the healthcare system and speak the languages of the different specialties in a way that many other specialties may have difficulty. And finally, at home, we're the public face of our healthcare system, and it makes sense that we translate those skills as best as we can to extend healthcare to everybody who needs it, not just for humanitarian response, but for emergency medicine in general. So thank you so much for your time. I'd be happy to take any questions by email. Feel free to reach out to me at smkivlehan@bwh.harvard.edu. And thank you again for your attention.